Great, so we are recording. Like I was saying, welcome everyone to the call. This is our Partner Portfolio Healthcare Series. We have John Hamilton speaking today. And with that, I'm just going to kick it right over to you, John. Oh, you're on mute.
Thanks, Mary. Thanks everybody for joining. Really happy to be here. Happy to join you. Happy actually for your participation. A little bit about me. Again, my name is John Hamilton. I've been in healthcare for over close to 30 years. I've been I've been a featured speaker across the country on technology, healthcare, and mobility trends to CIOs, chief medical officers, and CTOs. My role basically at Windstream is a consultant, and my goal is really looking at how technology impacts and changes the digital journey. And I'll kind of go through that in the presentation, and then we'll pause for any questions during that. So, without ado, let's move forward. So I think, some of you have already seen this slide. Ultimately, we're looking at, solutions that Windstream has to optimize, engage, and protect, really wrapped around with our professional services. These are a number of the things that are winning within healthcare space. And some of the things that we've found that are very unique. And I'll kind of go through that as we go through the presentation. We put this digital journey together probably about a year and a half ago. And, the interesting thing is because of COVID, it's changed forever. And we're starting to see some really interesting trends as it pertains to healthcare and how we're looking at kind of those three areas, right? Patient acquisition, patient care, and retention. And I was on the phone with a CIO yesterday and really talking about how the first part of that has really started to become more of a digital signature, especially with the social distancing, driving some of those online tools, those contactless pre-visits. No longer are we going to really have to worry about a lobby experience, but is there going to be a digital lobby? How about scheduling? I mean, everything is becoming that much more synonymous with technology. So really, as we look at that acquisition, it's changed a little bit. Care has changed as well, our middle section. So that provider experience may really kind of revolve around different types of meeting rooms or telemedicine. Your patient engagement is going to be totally different. I know that a lot of folks now are jumping on telemedicine calls to get prescription refills. That care planning is more of a collaboration with that. But ultimately, underlying this, right, is technology, and it's a digital journey. In that patient retention, that again is going to be very, very unique. Okay, in that we can shop for medical services anywhere, right? And so it's going to become a lot more important for the healthcare community to remain competitive and offer differentiation of services as it pertains to healthcare as a whole. What we're also starting to see that has become very unique is that working from home for those non-clinical employees. Again, talking to the CIO yesterday of a healthcare facility, he said basically that, they're moving those working from home folks more permanent. So what does that impact? It impacts VPN usage. It impacts how they tie into the network. It impacts, soft phones or communication, collaboration tools, all of that kind of stuff. So, the digital journey is real. And whenever I give this presentation like this, we always sit and talk about this and how the change of COVID has impacted really a lot of the things that we're dealing with. So I wanted to kind of dive into a little bit more into each of these areas and some of the solutions that we see in real time that Windstream provides and how we're able to address some of these things. So around that acquisition, right, you could have, customer care center, appointment reminders, cancellation notices, alerts, Call center integration. We're seeing a huge amount of interest in healthcare moving to the cloud, which is allowing them to really kind of open up some of their integration. When you have that screen pop of a call center and that patient record comes out right in front of you, you're able to address that patient by name, etc. Obviously, sometimes we're seeing some mobile registration, self-service, and then kind of that lobby experience, which is changing a little bit. We still need to see that network access and as well as that point of sale. Really around the middle area in patient care, right, we're seeing a number of the same type of things. But when it comes down to diversity and when it comes down to redundancy, SD-WAN is really kind of keeping its hold. We're seeing a lot of customers move and migrate from traditional MPLS to more of an SD-WAN, where you do have that redundancy, where they have the ability to look at the network, to manage the network, to prioritize different things. Remember, in healthcare, we're looking at imaging, we're looking at lab results, we're looking at electronic medical records, and a host of other things, video now. So healthcare really has needed to figure out a better way to manage their network, and SD-WAN has a huge amount of popularity. Obviously, we're seeing an increase with cyber attacks ever since COVID started of about 300%. So network security, security assessments, those HIPAA assessments, those have become very important as well. As we kind of move over, that electronic fax, unified communications, and then telemedicine, obviously, for that patient engagement. In the retention area, right, we're seeing a lot of other things, okay? So it could be that patient support follow-up, whether it's, communications, video, chat, voice, SMS, email, integrations. Obviously, telehealth continues to be visited here. And then that patient personalization when communicating. Obviously, the digital patient retention strategy is really important. And then as we kind of move over to the right, those discharge instructions, customer surveys, we're seeing, a huge push in that kind of that figuring out those net promoter scores, right? How are we doing compared to X? So I wanted to kind of go through those areas that, really kind of outline, Windstream's, our capabilities within the healthcare space. So I'm going to pause right there if anybody has any questions before we move on.
Nothing in the chat as of now, but yeah, feel free to add any questions in chat while John's going along if you don't want to forget your question or interrupt him.
Awesome. So one of the things I wanted to do is kind of, this is on a silly timer for some odd reason. One of the things I wanted to do is kind of put this in a picture, right? And the picture is really kind of like a clinic as a service. Let me get out of this. It's backing up on me. So the clinic as a service is really something that, I'm going to tell a story about this, but, it gives you a better idea of exactly some of the things that can be accomplished with Windstream. And it is really as a service. So, looking as we go around clockwise, around some of the things that are going on, right? So that primary, secondary connectivity via SD-WAN. SD-WAN is HIPAA compliant, and a lot of our solutions allow a healthcare facility to be HIPAA compliant. But, the ability to do white glove professional services, cloud phones, firewalls, etc. So really kind of building out a great story. And I'm going to tell you guys a story about this. So last year, we actually had the opportunity to go into a dental facility. And this was an 82-center dental facility. And, they had some issues. We initially went in and really we're going to talk about UCaaS, CCaaS. And what we ended up doing is I showed them that digital journey. And the COO at the time stopped me and said, well, wait a minute. So you guys can affect every single one of these components on the journey. And I said, yeah, we sure can. He said, tell me about it. So I started telling them about some of our capabilities as it pertains to their facilities. So their issues, two IT folks, okay, they had 82 centers, all of them disparate, okay, they weren't talking to each other. They had different technology at each of the facilities. If a facility went down, it would be at least a day before it was able to get up. So obviously they had some issues. Well, one of the things that we did as we proposed this entire solution for all 82 centers. We actually had a great story about that. Within a week, we presented this idea, and the idea really was instead of looking at a capital expenditure, move it to more of an operational expense. So basically, all of these solutions for flat rate each and every month per center. In 90 days, we were able to win that deal with all of these. And it was a $2.5 million 5-year contract. So something that I think that really starts to make sense when it comes down to it. So I wanted to share with you guys, well, here's the case study, right? Some of their challenges. We talked about, the disparateness of all their areas. We also talked about, if they wanted to improve the patient experience. They wanted to minimize the risk while maximizing their changes. Obviously, they wanted to have a performance edge over competitors. So the middle section is basically exactly what we proposed and what they purchased from us. The outcomes, I think, are incredibly unique. And from a CIO's perspective, as well as a business leader's perspective, anytime you can improve your technology to protect your business and brand is an incredibly valuable thing to do. Obviously, you're delivering value to your shareholders, you're improving your business valuation, as well as improving that staff and patient experience, being able to utilize that. With the ability to take it from a CapEx model to an operational expense, we're able to contain the costs and eliminate large expenditures. And ultimately, they improve their buying power. We were able to provide subject matter experts on the ground so that they didn't have to actually do it. So, one of my favorites is pave the way for the dental office or the healthcare office of the future, from that legacy to modern experience for staff and patients. So, Windstream is, an agile partner. If you didn't know, we have over 2,700 healthcare accounts within the United States, both from partners as well as direct. The other thing that they were able to do is looking at a contact center. We're going to improve the performance and integrate with critical applications like their patient management system. So some really, really good things that happen from this. Moving on, ultimately, the reason why they selected Windstream moving forward is really, I think, one of the great things is our flexibility and scheduling, right? So when you look at the project management of going out and retrofitting, 82 centers, obviously, it's based on their priorities. So what we were able to do is have a dedicated assigned project manager that has basically set up calls every single week to update both the dental group as well as the team on what's going on. So regularly scheduled conference calls. Obviously, we talked a little bit about the subject matter experts and the technicians on site and deploying their badged employees of Windstream. So it makes it really easy and more of a successful deployment. And then obviously there's a dedicated account team, which I'm a part of. We're pretty much dedicated to doing that both pre and post implementation. So in summary, obviously you guys know a little bit about Windstream, national technology aggregator, but we're also managed services provider, right? And I think that's the value thing around healthcare that we bring. One vendor to manage, one carrier vendor to manage as it pertains to deployment. So I will take any questions now that anybody has.
Yeah, John, I'll jump in with one that I got. So, going back to the topic of compliance, could you recap what Windstream offers from a compliance perspective?
Yep. So we offer compliancy when it comes down to most of our solutions. So obviously, I mentioned SD-WAN offers the ability for a healthcare entity to be HIPAA compliant, and that's the real key, right? So as we look around compliance, we can't make somebody compliant. We can offer solutions that allow them to stay compliant. So all of our UCaaS solutions allow a healthcare facility to be HIPAA compliant. Obviously, we have specific solutions like DDoS, that type of thing is driving me up the wall, and that's what makes it very valuable. So I hope that answers whoever had that question around HIPAA compliance.
Mm-hmm. Great. And then also, we shared the use case for the National Dental Organization. Do you have any other use cases we could share with our attendees that just to give them more of a perspective from a use case scenario?
Yeah, you bet. So we have 3 use cases. The first one is Communicare. It's a case study. The other one is Gaston Valley Health Center. They're located in the Northeast. And then we also have a Community Dental Partners case study. So I can provide those to Mary, and we can have it emailed out at the end of the call.
Mm-hmm. Great. All right. Any other questions from the audience? All right, pretty quiet group. With that though, thank you to John, our healthcare services consultant here at Windstream. And also watch for another invite from us, from your Windstream channel integration manager, channel manager, regarding a professional services partner portfolio that we are going to be doing likely 2 weeks from now on a Wednesday. We've been doing these on Wednesdays at 1 p.m. Central. So probably try to keep that same date and time. But again, that will be for professional services and what we offer and how, how that plays with your customers and prospects. So with that, thank you everyone for joining. We will look forward to seeing you all next time. And please reach out to your channel partner at Windstream with them.
Hey, Mary, somebody asked a question. Will we have a copy of the deck?
Oh. I think maybe internally we can share that deck, but as far as externally goes, we would probably work with your channel.
Yeah, I can help answer that. So if you guys want, I'm totally available to sit down in front of a customer and give a similar type of presentation or a customized presentation, whatever you guys want to do. So that my role is, John, is really to utilize what we have and on your behalf share it with your prospects. So more than happy to do that.
Great. Okay. Well, thanks again, everyone. We will look forward to seeing you all next time. Have a good one.